Hello, I'm Dr. Ken Sharlin. You are listening to the Parkinson's Solution Summit. And I am so very excited to welcome my guest today, a very dear friend, and truly, through her work, an inspiration to so many people. We are going to be talking today about coaching, functional medicine coaching, and how it applies to Parkinson's disease. The coach is at the center of the story of transformation and change. And who could be better to talk about this than Dr. Sandra Scheinbaum, the CEO of Functional Medicine Coaching Academy.
A coach is not someone who's going to tell you what to do. That's what the expert does. So that's what you may have had a lot of. And often you get useful education and useful advice. But sometimes you are told to do things that seem unsurmountable, or you don't know where to begin, or you don't know if it's right for you. Coach is going to be the listener. They take where you are now and they ask the questions that where you want to be. Based on what you are answering, they will help you to set goals that are realistic and accomplishable, are doable. And the field of coaching came from psychotherapy, came from humanistic psychotherapy. And what does that mean? It's not about what's wrong with you. It's about what's right with you. And it's what we call client-centered. You as the client are in the driver's seat. So coaches help people change when change is hard. And we know that if you are newly diagnosed with Parkinson's disease and you want a functional medicine approach, it often involves making some lifestyle changes or perhaps following a supplement regimen. And that can feel difficult or sometimes overwhelming. The coach will help you to get started and will make sure that you are successful by tweaking the plan, by coordinating with your doctor. Health coaching is slowly making inroads into conventional medicine. And why? It's because there is a body of evidence now. We get some solid research showing, some of this is international research, showing that coaching is remarkably effective. We also have the AMA, American Medical Association, looking at the feasibility of having reimbursable codes for insurance. When that comes to being, it's a matter of when, not if, then you will see coaching exploding with health coaches in every conventional neurologist office, for example. Functional medicine coaching is where a coach guides you to look at the root causes of your condition, to look at how you can implement a protocol that your functional medicine doctor may have created for you, and is your guide on that journey of root cause, evidence-based, personalized medicine, which is functional medicine. The ways that we were trained, I was giving Rorschach tests and MMPIs, the personality inventories, and coming up with a diagnosis and focusing on treatments that were all in your head, as opposed to the benefit of some of the looking at what you eat and what's the quality of your sleep and what about movement, putting all of those together, which is what functional medicine does, and creating a personalized plan. Can you imagine it? But I don't imagine a good future with this condition. Coach can guide you to see that, to picture laughing, to picture having joy. And this has been done even with people with Alzheimer's disease, focusing on how you can have still some quality of life. And we tend to think that there's no quality of life there, but that's not true. And with interviews with people who have that diagnosis, and also never giving up hope. Hope is the most powerful. Years ago, the work of Bernie Seidel with breast cancer, hope has always been shown to, that's character strength. And having that is strongly tied to physical and mental well-being. And we know that as a caregiver, that you are experiencing a lot of stress. You may feel a lot of guilt. I'm not doing enough. You may neglect your own self-care because you want to be the best possible caretaker. And we actually have a whole section when we train people to become coaches and how to care for caregivers, how to coach caregivers. And when you support the caregiver, everybody thrives. And so they are at risk as a caregiver. Just having having a conversation with a coach, giving them permission to step away, to perhaps problem solve, to see how they can have their own support. And they will also reveal things to a coach that they might not want to say to others, like feeling angry that this is happening in their family, or being very worried about the future, about finances, or so many issues that they may not want to discuss. And then the relationship issues. So sometimes working together as a couple can be really, really important. In fact, there was just a controlled study. It was showing they were coaching, this was with type 2 diabetes, but they were looking at dyad. So not just coaching the individual with the condition, but bringing in a family member, a spouse, for example. And it was very, very successful. Coaching was much more successful when they had the two of them being coached. The same would apply with Parkinson's or other neurodegenerative conditions as well, but particularly important here so that coaches feel like caregivers feel that they are not alone, that they have some support. You can go to our website, functionalmedicinecoaching.org, and go to find a coach. And you can find one in your area, but most coaches work remotely, so you don't need to go to exactly your area. And I would say that you want to find someone who is board certified. As a school, we are approved by the National Board for Health and Wellness Coaching. And so our graduates can sit for that exam and meet other qualifications. And that is important that you have a board certified or board certified eligible. And then it is a good match. You have a discovery session where you see, do I feel comfortable with this individual? And I also want to add that we have so many students who have a calling to serve others. And what brought that about? They have a condition themselves and they want to give back. And there is no better way to heal yourself than to support others. And so that is very therapeutic. And so we have many people decide, I'll be a health coach so that I can give back, I can support others with this condition.